through the client's lens, assisted outpatient treatment, also known as AOT. We're going to go ahead and get rolling. Other people may come in as we go. So what we're going to do right now is go over housekeeping, and just letting you guys all know that this webinar is being recorded. And if we ask you to mute your phone for some reason, it's just because of background noise. And you're going to go ahead and do that through your go-to training panel. I'm going to show you how to do that in just a minute if you're brand new to this platform. But if you have any questions at any time, you can always raise your hand. Again, I'll show you how to do that in just a moment, and we'll unmute you. All right. So if you all can look at this, if you can see the screen, it has the go-to training panel on the right side. So this should be what you see unless you're logged in on your phone. That's a different viewing. I don't have a picture of that, but if you're on your computer, this is what it looks like. And so the first notation is, if you will go ahead and click the next little doodad, because it's going to bring up. So this little button right here, this orange arrow where the red arrow is pointing, is your go-to training panel. Forgive me, you all. I have a brand new 1-year-old who has found his voice. But this is your go-to training panel button. So if you ever lose it, you can just click this button and it'll expand. The next one is going to show you how to unmute yourself. So this, if it's green, it means that you're unmuted. If it's red, it means that you are muted. The following button just confirms that you're muted, so you have double the backup in case you don't know, because we always like to ensure that we're muted. And then this little doodad is to raise your hand, I do believe. And then here you have the materials. So we have 2 things uploaded today. We have the slide deck and we have an infographic for you all. So please feel free to download that. And then here's your chat button. So feel free to type away if verbally speaking is not something you can do. If for some reason your go-to training panel disappears on you, look for this little flower button down in your menu, and that should resurface your go-to training, okay? Hopefully everybody got that. I'm gonna check the chat really quick. Good morning, good morning, good morning, everyone. Oh, wonderful, wonderful people. All right, so today's agenda, we're gonna go ahead and give a brief introduction of ourselves. We're gonna do an overview of who Access California is. Then we're gonna review what Laura's Law, AOT, is, for those of us that aren't familiar or just need a refresh, and then dive into what the Assembly Bill 1976 is in conjunction with AOT. We're going to also go over some recommendations that we have, and then have an open discussion if time allows us. So we're going to have a decent amount of things to go over today. So if you could kind of just sit back and let us roll through it. Some of your questions will be answered along the way, but again, do feel free to raise your hand or type your question in the chat box. I am going to just briefly introduce myself. I am Tiffany Carter. I'm the statewide advocacy liaison here with Access California, and I get to be Andrea's partner in crime with ensuring that we are creating sustainable solutions throughout the state for mental health advocacy, and working with our amazing subject matter experts, our ambassadors throughout the state as well. I'm glad to be here. I'm going to hand it over to Andrea to go ahead and introduce herself.
Thank you, Tiffany, and welcome everyone. And thank you so much. I'm so glad that Tiffany provides that overview. I do want to let you all know that I will not be able to present and check the chat box at the same time. So we'll be going back and forth checking that. But I do want to let you know that once we get through the content, as Tiffany said, we will have opportunity to review all of your questions in the chat box, and then opportunity for dialogue as well. So again, welcome everybody. My name is Andrea Crook, and I am the Director of Advocacy for Cal Voices and Access California. And so happy you all joined us this morning to talk about this very important topic. So without further ado, I'll give you a brief overview of our organization. So, Cal Voices, it's a continuation of NorCal MHA. We've been doing statewide work for many, many moons, and so we changed our name about a year ago, so it represents all of California. Our organization was founded in 1946. We are actually coming up on our 75th birthday, so we're really excited about that. We are the oldest continuously operated peer-run consumer advocacy agency in California. And as a peer-run organization, we specifically hire individuals with lived experience. And Access California is a program of Cal Voices, and it's a consumer-led statewide stakeholder advocacy program. And it's funded by MHSA, so Prop $63. And we have a contract with the Council on Criminal Justice and Behavioral Health, also known as CCJBH, because all of us in behavioral health, we know how much we love our acronyms. So if at any time we're using acronyms throughout this, feel free to type it in the chat box or ask us later. But we'll do our best to say them in their entirety. For example, Access California, it stands for Advancing Client and Community Empowerment Through Sustainable Solutions. And our mission is to strengthen and expand local and statewide client stakeholder advocacy in California's public mental health system through individual and community empowerment. So through our ongoing research, data collection and evaluation, legislative and policy analysis, advocacy, education, training, outreach, engagement activities. It's a lot. Access implements strategies to really elevate the voice of individuals with lived experience and identify the needs and increase genuine public participation of client stakeholders to drive truly transformative change in California's public mental health system. So we value advocacy and really the meaningful voice of individuals with lived experience so that they can shape the services and systems that are there to provide support to them. And we absolutely believe in recovery for all and peer support as a means to that. So when we talk about advocacy, we're really talking about meaningful stakeholder participation, active solicitation of community feedback, expanded opportunities for involvement and inclusion at all levels. And as it states in the MHSA, this includes policy development, program planning and implementation, service delivery, oversight, and administration. And when we talk about recovery, we're really talking about the infusion of all the recovery principles in all aspects of service delivery. And recovery-based training and supports for mental health professionals, and tracking and reporting and the analysis of recovery outcomes in all mental health programs. So we really are striving to marry the recovery model and the medical model and have all of our outcomes really be driven through a recovery lens and what meets the individuals that we serve needs. And when we talk about peer support, we really want to ensure fidelity to the evidence-based model. And that includes universal training on professional standards, core competencies, and practice guidelines, as well as the incorporation and expansion in all mental health programs. And of course, we need to ensure that along with that comes a living wages, ongoing professional development for our peer providers, and opportunities for career advancement in the peer support field. So last slide about access. We conduct ongoing qualitative and quantitative research throughout the year, ongoing advocacy at both the local and state and legislative level. We do ongoing education, such as this webinar, after COVID and pre-COVID, we do a lot of education throughout the state of California for both mental health providers, county and state leadership, as well as clients, stakeholders, and ongoing engagement with all of our stakeholders. All right, with that, I'll go ahead and pass it back over to Tiffany.
Thanks, Andrea. All right, so hopefully you all are feeling good about what Access does, because we're going to jump right into Laura's Law and just give you guys some information for those of you that aren't familiar, for those of you that just need a little bit of a refresh. So assisted outpatient treatment is California's AOT law, and it's more commonly known as Laura's Law. And it was created as a direct response to a gun violence murder by a person with serious mental illness, also known as SMI. And the victim was a college student named Laura Wilcox in Nevada County back in 2001. AOT is currently authorized in each county, or authorizes each county to choose a way to offer specific mental health programs and or services by a way of resolution adopted by the county board of supervisors or through the county budget process. The main objective of AOT was to create a court-ordered and supervised treatment plans that can be utilized with community resources that are least oppressive. AOT is an alternative to being involuntarily committed for threats, attempts, and or violent actions. Here in California, local counties have been able to opt in to implement AOT because of the controversies surrounding such programs. And the AOT demonstration project of 2002 was originally set to sunset January 1st of next year, 2022. So Assembly Bill AB 1976, which just passed, which is the Eggman Assembly Bill, says that commencing July 1st of this year, 2021, it will instead require a county or a group of counties to offer AOT mental health programs unless a county or a group chooses to opt out, choosing not to be involved. And this is done by a resolution passed by the governing body stating that reasons for opting out and any facts or circumstances that relied on making that decision. The bill authorizes a county to instead offer those mental health programs in combination with one or more counties, subject to specific implementation provisions. So keep that in mind. The bill additionally prohibits a county or group of counties by implementing these provisions from reducing existing voluntary mental health programs serving adults or children's mental health programs as a result of the implementation. And this bill repeals the expiration date that I previously stated of Laura's Law, thereby extending it indefinitely. All right, so we've, said a few things about what Laura's Law is and what AB 1976 is. Well, why does it matter? Well, here's a couple of things that really shine some light on this. Under this new law, counties must divert critical mental health resources to AOT programs, regardless of actual community needs and despite the unprecedented challenges that they face from the current COVID-19 pandemic. AOT additionally is antithetical to the recovery model and prioritizes the very fail first approach California voters rejected back when we passed the MHSA in 2004. Additionally, counties can opt out of AOT as the new statute takes effect July 1st this year. The opt-out date may be extended by DHCS guidance. We'll know more about that as that unfolds. So something really important here to pay attention to is that if a county adopts the AOT, it's really important that us as advocates, we hold our counties accountable for complying with all the legal requirements that AOT programs are required to provide by the California Welfare and Institution Code. So there's mobile community mental health teams. These are community-based, mobile, multidisciplinary highly trained mental health teams, right? There's county staffing. We must ensure that there's sufficient county staffing with the necessary cultural backgrounds and linguistic skills to remove any barriers to mental health services. Client-directed services, this must be client-driven, recovery-oriented, and integrated services. Peer support, that is definitely for the peers, family support, and parenting support. Housing is housing for clients, so that's immediate, transitional, that's permanent, or all three. Data collection, collect comprehensive outcomes data of data and submit an annual report to DHCS. Individual service plans, so these are also known as ISPs, and they are designed to further recovery, including enabling recipients to obtain employment, create community connections, or improve their physical and mental health, and to reduce criminal justice involvement. Personal service coordinators, PSCs, those acronyms. These individuals create comprehensive, all-inclusive plans for services, which really address the varied needs that individuals have and include unique services for clients from unserved and underserved communities, those with disabilities and older adults. Then there's unique services, so that's broad services addressing the unique needs of women and individuals from diverse cultural backgrounds. And education and training, so in consultation with stakeholders, they are to develop training and education program to ensure that individuals subject to involuntary treatment are directed to the most effective treatment. So I took a kind of a pause here to really explain all of these, because this is what we have to hold our counties accountable to comply with should they choose to adopt AOT. So all of these things are required by the Welfare and Institution Law. I'm sorry, the Welfare and Institution Code. So keep that in mind. That's really important. All right, next slide, please. All right, so some recommendations. What can you do? Okay, you've told me all this stuff, Tiffany. And so what can I do right now, especially with this being potentially adopted July 1st? So you can just say no. You can tell your county leadership to opt out, right? I know that sounds simple enough, but it truly is. You can definitely use your voice. Let your mental health director know that you're opposed to implementing AB 1976 in your county. You can also let your MHSA coordinator know that you're opposed to funding AB 1976 with MHSA dollars. Let your mental health board or your behavioral health board know that by investing in AB 1976, they're going to be possibly taking money away from much needed services and supports, and that MHSA funds are not to be utilized for AB 1976 without a community program planning process, a CPP. Remind your county about the requirements that they will have to comply with, that whole list that we just went over, and that will take them further away from embedding a recovery model of care. You can additionally convey that this bill creates unnecessary mandates on the counties by requiring their participation and removes each county's local control. The MHSA was written to promote local control, right? Additionally, remind your county and your mental health and behavioral health board that the MHSA invests in the recovery model. The MHSA fund is for effective and accessible community-based services, which limit their use or need for involuntary services. And advocate that prioritizing funding for involuntary services further stigmatizes mental health clients and consumers and discourages clients from seeking services for fear of being ordered into treatment. And we all know that that is definitely what we want to protect as much as possible. Additionally, you can state that involuntary treatment does not promote the evidence-based practice of client-driven and recovery-oriented services that utilize shared decision-making and client empowerment. By definition, an involuntary treatment program cannot utilize shared decision-making which is woven within the fabric of the MHSA, right? You can also inform your county and your mental health board or behavioral health board that the amendments should specify that all of the AOT services required in section 5348 should be available to an individual in the county where the recipient of services resides or in an area that's readily accessible, right? And if your county has AOT or chooses not to opt out, become knowledgeable about all those requirements that we went over a few slides ago to ensure that existing services are maintained and sufficient additional services are created to effectively implement the law. And if your county has AOT again and doesn't choose to opt out, ensure that you are involved in the creation of the comprehensive plans for services required by the Welfare and Institution Code. So really arm yourself with good information so that you can know how to move forward and how to be of support and how to advocate appropriately. I'm going to go ahead and hand over the summary to Andrea.
All right, thank you, Tiffany. So again, in summary, this bill is set to remove the January 1st, 2020 sunset of AOT. The amendments to AOT have transformed the nature of AOT by requiring a county to opt out of the program as opposed to choosing to opt in or choosing to participate. Mental health advocates believe that the sunset of the act should remain for at least 3 years so that the impact of the AOT program can be evaluated under the new structure and to capture data and impacts of the modified program. So, in order for a county to opt out, a county or counties must do so through a resolution passed by their governing bodies, such as their mental health or behavioral health advisory boards, the board of supervisors, stating the reasons for opting out and any facts or circumstances relied on in making the decision. And this, again, can be done through your community planning process and ensuring that your voice is being heard at your local behavioral health board, you're meeting with your MHSA steering committees, that you're taking any opportunities that your county provides for public participation and input to have your voice or concerns addressed. All right. So that now we're going to open it up for any questions, comments, or feedback. And I'm going to go ahead and come over here and look at the chat box and see if I've missed anything. Oh, I'm sorry. I have everybody on mute. Let me go ahead and unmute y'all. All right, you're all unmuted now. Okay, are there any questions?
This is Hector. Can I get in the queue?
Yeah, you may, and I'm not seeing any.
Oh,
Yeah, Hector, I
thank you.
see your hand up, so you're on.
Thank you. Yeah. So this is a very important thing. I'm in like in Los Angeles County, and I know I've been part of following this for many years, and I know it's very surprised that there's a required CPP for this, a community planning process, because I know as an Access ambassador in the past years, I have requested to be part of the AOT group that the department has, and I and ambassadors, we have been left out. Our mental health commission chair is the one that appoints who's part of the body, which I thought was public, and we have been left out of those conversations completely. So I'm not really sure. I mean, how do we advocate for even our place at the table, which is ridiculous that we should be doing for this? But it's really really good that you bring this information because this is a big thing here in LA County. A lot of money goes into this that could be used to help so many of my peers, who are trying to get help or even get off the streets.
Right. Thank you, Hector. Are there any other comments or questions?
Yeah, this is Lorraine.
Hi,
I'd
Lorraine.
like to know, hi. I'd like to know how do we ensure that these requirements in the welfare and institution codes are met? How do we quantify that all the requirements are met? Is there a way?
it depends. I know what county you're residing in. Now, a lot of counties hold ongoing oversight and advisory bodies. I would encourage you to work closely with your mental health board and your commission to ensure that they are being met, and to ensure that they're aware of all of the requirements as well, and as well as work with your behavioral health director.
Thank you.
Good morning, this is Robin.
Good morning, Robin.
Hi. I think for me, the biggest issue that I have with AOT is that very few of our clients, or not our clients, but very few of our consumers will benefit from this. It is an extremely lengthy process. You have to fall under the guidelines in order to receive those services. It's like 8 defining guidelines or something like that. And I mean, it's not even a handful of people that will actually go through this whole process. That's an awful lot of money to spend for a program that really isn't all that. I mean, we could really take that money and put it into the services that we have and expand on the services that we have and really make our communities robust. That's just my take on it.
I wholeheartedly agree, Robin. Thank you for sharing.
I second that.
Anyone else? I do want to remind you all, if you haven't already downloaded the materials in the chat box, we have included a copy of our slide deck as well as an infograph that we hope that you'll find meaningful and you'll be able to take back to your decision-making bodies and your planning committees, and share this information with your fellow constituents in your community when deciding whether to opt out, or if you already have it, to ensure that we're upholding the MHSA when MHSA dollars are being utilized to help supplement these programs if they are to be. So make sure you download those. And opening it up, are there any other questions or comments? Oh, I do see a couple hands up. Heather, you're on.
Hi, my name is Heather Vance. I'm the director of the Turning Point program in Nevada County that runs our AOT program here. And I just wanted to mention the funding piece. The funding for our program is it goes to our ACT program, which is what we're an ACT program, and our AOT program is just a part of the ACT program. So everyone that's referred to us as offered ACT services voluntarily initially. So the funding it's just funding the ACT program. There isn't any extra funding that has to go into the AOT program because our ACT program is already in place. And our ACT program encompasses all of the things that were listed as required for an AOT program.
Thank you, Heather.
Mm-hmm.
I'm not seeing any other hands up. Are there any other comments or questions before we conclude this presentation? Okay, well, if there's nothing else, we just thank you all so much for coming and joining us today to learn a little more. And if you have any questions that come up after, let me put up the next slide. You feel free to contact us or by email or phone, and follow us on social media. And we thank you all for spending this morning with us. Vernon, I see your hand up. You're on.
Good morning, Mrs. Crook. Can you hear me?
Yes, good morning, Vernon.
Thank you so much for allowing me to speak this morning. I do have one question. This recording, will we be able to share this or just the PowerPoint with key figures in our community that are on the fence line of decision making of this policy? Thank you for allowing me to ask this question.
Hi, Vernon. Yes, absolutely. We're going to be posting a recording of this webinar to our website, and feel free to share the infograph. That is also, we encourage you to use that to educate your fellow stakeholders and community partners, as well as the slide deck if folks find that meaningful. Absolutely.
The reason why I ask that, because there were some things mentioned in this brief webinar this morning that was very profound, very articulated, but very to the point. And I think that this could, really help people make up their minds. Thank you so much.
You got it. Thank you. And thank you for your feedback. We appreciate it. Let me see. Any other hands up? Anything in the chat box, Tiff? I'm not seeing any hands.
I'm not seeing anything there. Everyone we must have done a very good job explaining it.
Well, I'd like to.
Well, thank you all so much, and have a wonderful day, and don't hesitate to reach out if you have any follow-up questions. And yes, please do visit our website. We will be posting a recording of this, and feel free to use our handouts.
Thank you, Andrea and Tiffany.
Thank you.
All
right,
thank
y'all.
you. I see you in the chat box.
Thank
Awesome.
you.
Thank
All
you.
right.
Thank you so much, Access, Tiffany, and all those who spoke. Thank you.
Glad to hear your voice, Dale.
Hugs and high fives to everyone.
Yes.
Hugs back at you.
Right back at you guys.